Hello, today we will be discussing all things medications, body weights, calculating medications, sterile versus non-sterile syringe, categories of medications, drawing up your medication, and how to write your patient on the medication board. Let's start with body weights. In wildlife, we do not use pounds or ounces. We use grams and kilograms. There are 1,000 grams in 1 kilogram. So as a brief example, if I wanted to know how many kilograms my 96-gram dove weighed, I would divide by 1,000. My 96-gram dove would weigh 0.096 kilograms. In order to begin calculating medications, we need to grasp a couple of terms. Dosage. Dosage is the amount of drug per body weight to be administered in a single dose, usually measured in milligrams, and it's illustrated as milligrams per kilogram. Concentration indicates that the medication we're working with is a liquid. It reflects the strength of the liquid, usually represented as milligrams per milliliter. So as we just discussed, liquid medications come in different forms. This bottle of Medicam comes in 3 concentrations. The first 2 are administered orally. The third, and most concentrated, is administered as an injection. The manufacturer of the medication determines which route of administration is most suitable for which concentration. Appropriate routes of administration will vary from drug to drug and sometimes species to species. So to briefly review, the lowest concentration of Medicam is 0.5 mg per ml, indicating that there is 0.5 milligrams for every milliliter of liquid. As we know, medications also come in tablet or capsule form. Tablets enable us to administer larger doses of medication in a manageable and reasonable form of administration. When calculating drugs for a patient, these are usually a better option for your larger species such as geese, ducks, gulls, and crows that pound for pound are going to be receiving more milligrams per dose than a smaller songbird such as a robin or pigeon. So how does one choose which medication type is best? There is no short answer. One must consider the size of your patient, which route of administration is available to you, and in some cases, which drug amount is more economical or safe to give. Consider this. If I wanted to administer a pain medication to a fox, my likely choice will be something I can inject or put in his food. For safety reasons, I do not want to choose a medication that I have to administer directly in his mouth. Or, along that same vein, if we had a bird with a beak fracture, oral forms of medication are no longer an option. I would be forced to use injectable drugs, as we do not want to continuously pry on a broken beak. When you arrive on your shift, it is unlikely that you will be the one selecting which medication is best for which patient. However, it is important to know what options are available in the event we have to switch for one of the above-mentioned reasons. So, let's get to the actual calculation formula. We start with our weight in kilograms, multiply it by our dosage, and then divide it by the concentration. The first problem you may encounter is that the majority of our patients are measured in grams because they are small. As we discussed earlier, to change from grams to kilograms, you would simply divide by 1,000. So let's practice. We're going to work with this 79-gram dove that needs Medicam. In the treatment room on the wall, the most commonly used drugs are all listed out with their various forms and dosages depending on what species you're trying to treat. In this case, the dosage for a bird is 0.5 milligrams per kilogram, and the concentration we're going to use is 0.5 milligrams per milliliter. If we input our numbers into the formula, it looks like this. 79 grams divided by 1,000 times 0.5 divided by 0.5 equals out to 0.079 milliliters. Our syringes do not measure out to the thousandth, so we'll round up to 0.08 milliliters. Let's work with something larger, say this goose for example. The medication I want to administer is an antibiotic called Clavamox, and he's going to receive it in tablet form. Since we're no longer using liquid, I would simply omit the last portion of our formula, which is the concentration. I only want to know the appropriate amount of milligrams he should receive in a single dose, and from that I will select a combination of tablets to obtain the correct dose. So our calculation became remarkably easier. Our goose weighs 3.8 kilograms. Since my weight is already in the correct unit, I do not have to convert from grams, so I no longer have to divide by 1,000. The dosage for Clavamox is 125 milligrams per kilogram, and the tablets come in those listed amounts. 3.8 kilograms times 125 equals 475 milligrams. I would choose to administer two 250 milligram tablets to round up to 500 milligrams. Keep in mind that many of our patients are arriving underweight. It would be okay in this case to round up slightly. So now that we've run through a couple of examples, here's your opportunity to practice. You will receive the next minute or so to practice this example, and then we'll give you the answer. Moving on, now let's discuss the different classifications of syringes you will encounter in the hospital. The first of which is oral syringes. Once an oral syringe, always an oral syringe. Oral syringes are used for tube feeding or administering medications by mouth. Once they are used, they are to be dried immediately in the dish soapy water next to the kitchen sink and left out to dry. Sterile syringes are located in the treatment room and should remain in the treatment room. When a sterile syringe is used, it is taken apart and placed into the blue bucket under the exam table. The blue bucket contains a solution to aid in removing biomaterial from the plastic. At the end of the day, the syringes are rinsed clean and left out to dry. Once dried, they will be repackaged and sent off to the autoclave to be sterilized for another round of use. There is an exception, however, to this sterile syringe protocol. 1 ml and 3 ml syringes do not withstand the heat and pressure of the autoclave. When these syringes have completed their sterile task, they will be separated from the needle and join the circulation in the kitchen area to forever become oral syringes until they fall apart. Sterile syringes are just that. They are sterile. They are the only syringes that should be used for pulling medications out of sterile bottles or administering medications as an injection. Do not use a non-sterile syringe for a sterile procedure, as you will be introducing bacteria and germs into a sterile environment. New this year, we are reintroducing O-ring syringes to the mammal nursery. These syringes are great. They have a rubber O-ring and they are visually distinguishable from the normal syringes in the kitchen. O-ring syringes are very expensive because they have a much longer shelf life than regular syringes. For this reason, they glide nicely and they're a very important tool for feeding young rabbits or squirrels. If you encounter an O-ring syringe outside of the mammal nursery, please return it to the nursery as soon as possible. Also, do not remove O-ring syringes from the mammal nursery for any reason. Let's talk about some common groups of medications. I won't get into too many specifics. There are many useful charts to help you decide which medication is best for which patient for whatever situation you may need it. The common groups of medications are pain management, antibiotics, and antiparasitics. All of the medications are either located in the medication cabinet or in the refrigerator in the treatment room. They are alphabetically organized to help with finding what you're looking for. Please ask questions whenever you need help or assistance. Okay, so we've calculated our drug, we've located our drug, and now it's time to draw it up. When reading a syringe, we read from the top of the rubber plunger. Also, it's important to consider, what does each hash mark or tick mark indicate on the syringe I'm using? In this example, every tick mark represents 0.2 mLs. This syringe is demonstrating 3.2 mLs of liquid. In this example, our syringe is capable of dosing up to 0.5 milliliters or 1/2 milliliter of medication. Each tick mark represents 0.01 milliliters. This syringe contains 0.24 milliliters of medication. The most common mistake when drawing up medications is not recognizing where the decimal point is located. The number amount on these syringes looks similar, but the syringe on the left is 10 times more than the syringe on the right. Giving this incorrect dose to a patient can and will likely cause kidney or liver damage, especially in a patient that is dehydrated. It is critical that we are extra careful when we write medication instructions on the treatment sheets, and when we are administering medications, that we know exactly what we are giving that patient, because there's no taking it back once it leaves the syringe. Please double check your work and have other teammates double check your work as well. It could save a life. Our last topic is placing the animal on the medication board. There are a few rules to follow so that we have some consistency from patient to patient. There are many commonly used abbreviations when it comes to dosing and daily instructions. There's a small cheat sheet near the medication board in the event you forget what some of these abbreviations mean. The only things that are written in black marker are the animal species and its ID number. This helps our eyeballs distinguish animal to animal much easier. The medications or instructions are then listed in any other color. In a perfect world, the treatment with the longest duration is written at the top. That way, the treatments with the shorter durations are listed at the bottom and will be erased going upwards as they are completed. As we can see in this slide, meds that are BID or twice daily will have 2 associated circles. Meds that are QID or 4 times daily will have 4 associated circles, indicating it needs to be done 4 times a day. I also like to leave a space between the action items and the circles with the dates. As the circles and dates are erased daily, this helps to keep the action items, or the things written on the left, from accidentally being disturbed when the items on the right are erased every morning. Also, some folks like to write comically large X's through the action item once it's completed. Please refrain from writing overly large X's, as it makes it very difficult for the morning shift on the next day to erase them all sufficiently without disturbing the surrounding instructions. I hope you found this video helpful. As always, if you have any questions, we'll see you at the shelter.